Hello and welcome. Today, we're diving into a complex and rare group of neurological disorders known as neurodegeneration with brain iron accumulation, or NBIA. The term NBIA isn't a single disease, but rather an umbrella term for a collection of genetic disorders. These disorders are all characterized by the abnormal buildup of iron in specific areas of the brain. The underlying cause is genetic. Specific gene mutations disrupt the normal cellular processes involved in iron metabolism and transport. This genetic inheritance pattern is often autosomal recessive, meaning both parents must carry a copy of the mutated gene for their child to be affected. However, some forms of NBIA can have other inheritance patterns. Identifying the specific gene mutation is crucial for diagnosis and family counseling. So, what exactly happens in the brain? The excess iron primarily accumulates in regions like the basal ganglia, which are critical for movement control. This iron overload leads to oxidative stress, causing damage to neurons and other brain cells. Over time, this progressive neurodegeneration results in the wide array of neurological symptoms associated with NBIA. The specific regions affected and the extent of the iron accumulation can vary depending on the type of NBIA, leading to differing clinical presentations. NBIA disorders are incredibly rare. Their exact prevalence is difficult to determine, but it's estimated that they affect only 1 to 3 individuals per million. This rarity often poses diagnostic challenges, as many physicians may not be familiar with the condition. NBIA affects individuals worldwide, with no particular ethnic or geographic predisposition. Because it is a genetic condition, the occurrence is linked to the presence of mutated genes within families. The signs and symptoms of NBIA can vary greatly depending on the specific type and the age of onset. However, common features include progressive motor dysfunction, such as dystonia, characterized by involuntary muscle contractions and abnormal postures, spasticity or muscle stiffness, and Parkinsonism, with symptoms like tremor, rigidity, and slow movement, are also frequently observed. Cognitive decline, speech difficulties, swallowing problems, and visual impairments can further complicate the clinical picture. Psychiatric manifestations, such as behavioral changes and depression, can also occur. It's important to remember that the severity and progression of these symptoms can vary significantly among individuals. Diagnosing NBIA can be challenging due to its rarity and the variability in its presentation. A thorough neurological examination is the first step. Magnetic resonance imaging, or MRI, of the brain is critical to identify the characteristic iron accumulation in the basal ganglia. Genetic testing is essential to confirm the diagnosis and identify the specific gene mutation responsible for the disorder. Other diagnostic tests, such as blood tests to assess iron levels and metabolic function, may be performed to rule out other conditions. While all NBIA disorders involve brain iron accumulation, they are classified into several distinct subtypes based on the specific gene involved and the associated clinical features. Some of the more well-known types include pantothenate kinase, associated neurodegeneration, or PKN, formerly known as Hallervorden-Spatz syndrome, neuroferritinopathy, oscilloplasminemia, and mitochondrial membrane protein-associated neurodegeneration, or MPN. Each subtype presents with a unique combination of symptoms and has a distinct genetic etiology. Identifying the specific subtype is crucial for genetic counseling and can provide some guidance regarding prognosis. Unfortunately, there is currently no cure for NBIA. Treatment focuses on managing the symptoms and improving the quality of life for affected individuals. Medications, such as baclofen and botulinum toxin injections, can help alleviate spasticity and dystonia. Deep brain stimulation, a surgical procedure involving the implantation of electrodes in the brain, may be considered in some cases to reduce motor symptoms. Physical therapy, occupational therapy, and speech therapy play crucial roles in maintaining function and independence. Nutritional support and feeding tubes may be necessary to address swallowing difficulties. A multidisciplinary approach involving neurologists, geneticists, therapists, and other healthcare professionals is essential for comprehensive care. As NBIA is a genetic disorder, there is currently no known way to prevent it from occurring in individuals with the predisposing genetic mutations. However, genetic counseling and carrier testing are crucial for families with a history of NBIA to understand the risk of having affected children. Prenatal testing may also be available for couples at risk to determine if their fetus has inherited the mutated gene. The prognosis for individuals with NBIA varies significantly depending on the specific type, the age of onset, and the severity of the symptoms. Some individuals may experience a relatively slow progression of the disease, while others may have a more rapid decline. Ongoing research is focused on understanding the underlying mechanisms of neurodegeneration in NBIA and developing new therapies to slow or halt the progression of the disease. Clinical trials are underway to investigate the potential of iron chelators, which are drugs that bind to iron and remove it from the body to reduce iron accumulation in the brain. Gene therapy is also being explored as a potential future treatment option. While NBIA remains a challenging condition, ongoing research offers hope for improved outcomes in the future.